Anatomy and Physiology, Upper and Lower Extremity Circulation. Today we're going to talk about blood supply to the arm and blood supply to the leg. We're going to talk about arterial blood supply and venous drainage to both the upper and lower extremity. Let's start with the upper extremity. Let's start with the subclavian artery, which originates from the brachiocephalic artery on the right, but directly off the aorta on the left. Once it passes the lateral border of the first rib and enters the axilla, it becomes the axillary artery. It's renamed the brachial artery once it passes the lateral border of the teres major. So once you enter the arm, this main artery becomes a brachial artery. And also, distal to the teres major, the brachial artery gives off the profunda brachii artery, otherwise known as the deep brachial artery, which is right here. Distal to the antecubital fossa, i.e. the front of your elbow, the brachial artery bifurcates into the radial and ulnar artery. So you got your radial artery, your ulnar artery. Then your radial and ulnar arteries anastomose, which means they come together, they join in the hand to form the superficial and deep palmar arches. And of note, the radial artery and ulnar arterial pulses are typically palpable in the radial and ulnar aspect of the wrist, respectively. And these palmar arches give rise to the digital arteries, the little arteries that go to the fingers. Now let's talk about the venous drainage of the upper extremity. Venous drainage is divided into superficial and deep systems. In superficial venous drainage, these veins are typically located subcutaneously. And it consists of the cephalic vein and the basilic vein. Those are the two main superficial veins of the arm. And they're connected by the medial cubital vein or medial antecubital vein. Then you have your deep venous drainage, which consists of named veins, which parallel the arterial supply of the arm. And perforating veins, which I forgot to mention, connect the superficial and deep systems. And therefore, blood goes from superficial to deep. And this is just an example of a perforating vein, connecting the superficial and deep vein. And veins have one-way valves, which allow blood to flow towards the heart without refluxing backwards. Now let's talk about arterial supply to the lower extremity. The aorta bifurcates into the left and right common iliac arteries. Each iliac artery again bifurcates into the internal and external iliac arteries. The external iliac artery crosses the inguinal ligament and becomes the femoral artery. So this external iliac artery crosses, becomes the femoral artery. And then just distal to the inguinal ligament in the femoral triangle, the femoral artery gives rise to the profunda femoris or deep femoral artery, which is right here. And the profunda femoris gives rise to the medial and lateral femoral circumflex arteries and various perforating branches. Once the femoral artery crosses the adductor hiatus, which is an opening in the adductor magnus muscle, it becomes the popliteal artery. The adductor hiatus is also known as Hunter's canal, in case anybody cares. Arterial supply to the lower extremity continued. The popliteal artery bifurcates into the anterior tibial artery and the tibial peroneal trunk. The tibial peroneal trunk then further divides into the posterior tibial and peroneal or fibular artery. So you got your popliteal artery looking from the back, looking from the front, popliteal artery going behind the knee, divides into the anterior tibial. You got your posterior tibial and your fibular peroneal artery. Anterior tibial, posterior tibial, fibular artery, or peroneal artery. The anterior tibial artery becomes the dorsalis pedis artery in the foot. And this dorsalis pedis pulse can be palpated on the dorsum of the foot. And the dorsalis pedis anastomoses with the lateral plantar artery to form the deep plantar arch. So you got your lateral plantar, dorsalis pedis, plantar arch. The posterior tibial artery, of note, the posterior tibial pulse can be palpated behind the medial malleolus of the ankle. So behind that bump on the inside of your ankle, that bony bump, you can feel the posterior tibial artery. And this divides into the medial and lateral plantar arteries of the foot. And like I already mentioned, the lateral plantar artery anastomoses with the dorsalis pedis artery to form the deep plantar arch. Now let's talk about other blood supply to the thigh and glutes. So even though the external iliac gives rise to most of the blood supply to the leg, the internal iliac artery plays a role. It gives off the obturator artery, the superior gluteal artery, and of course if there's a superior gluteal artery, there has to be an inferior gluteal artery. And those arteries supply the thighs and the glutes. Now let's talk about the venous drainage of the lower extremity. Just like in the upper extremity, there's a superficial and deep system, and there are perforating veins that connect the two. Your superficial venous drainage, which are your subcutaneous veins, consist of the great saphenous vein and the small saphenous vein. The great saphenous vein is longer, that's why it's called great, and it's located on the medial aspect of the leg. Okay, it ascends anterior to the medial malleolus, and then posterior to the medial condyle at the knee, and then it drains into the femoral vein just below the inguinal ligament. You have the small saphenous vein, which is located on the lateral aspect of the foot, which runs posterior to the lateral malleolus and drains into the popliteal vein behind the knee. And of course, your deep venous drainage consists of named veins which parallel the arterial supply of the leg. Now let's put this all together. The arterial blood supply to the upper extremity is from the brachial artery. The arterial blood supply to the hand is from the radial and ulnar arteries, which ultimately come off the brachial artery anyway. The deep venous drainage of the upper extremity parallels the arterial blood supply. In addition, there is superficial venous drainage of the upper extremity consisting of the cephalic and basilic veins. The arterial blood supply to the lower extremity is from the femoral artery. There is additional blood supply to the thigh and glutes from branches of the internal iliac artery, such as the obturator and superior and inferior gluteal artery. The arterial blood supply to the lower extremity below the leg is from the anterior tibial, posterior tibial, and peroneal arteries. The arterial blood supply to the foot is from the anterior and posterior tibial arteries. The deep venous drainage of the lower extremity parallels the arterial supply. In addition, there is superficial venous drainage of the lower extremity consisting of the great and small saphenous veins. The end. Thank you very much. Like this video, subscribe.